Yes, today I will summarize the two articles, academic articles. The first one is coffee, caffeine, and health outcomes, an umbrella review. And the second one is effects of habitual coffee consumption on cardiometabolic disease, cardiovascular health, and all-cause mortality. The core is this figure. For hepatocellular carcinoma, colorectal adenoma, oral cancer, pancreatic cancer, melanomatous skin cancer, endometrial cancer, and non-melanomatous skin cancer, esophageal cancer, proximal colon cancer, prostate cancer, colon cancer, distal colon cancer, adult glioma, colorectal cancer, breast cancer, renal cancer. The drinking coffee was protective to these cancers. The relative risk was from 0.50 to 0.9998. However, the 95% confidence interval contained 1. So this means that these estimates are statistically insignificant. In particular, if the 95% confidence interval include 1, relative risk 1. So, however, the power of these statistical estimates can be changed if more participants are recruited or several other confounders were additionally adjusted. So, yes, however, the drinking coffee is hazardous to gastric cancer, childhood acute leukemia, acute lymphoid leukemia, childhood acute leukemia, and childhood acute myeloid leukemia. Yes, the risk estimate was 60% higher for drinking group, coffee drinking group for gastric cancer compared to non-drinking group. For childhood acute lymphoid leukemia, 43% were higher for drinking coffee group than non-drinking coffee group. For childhood acute myeloid leukemia, 81% higher in drinking coffee group than non-drinking coffee group. However, the 95% confidence interval included 1 for childhood acute myeloid leukemia. So we should understand these results considering the 95% confidence interval. For cardiovascular outcomes, yes, coffee drinking is protective for most diseases. However, a slightly increased risk of hypertension was reported. However, the 95% confidence interval was statistically insignificant. For other diseases, for most diseases, the coffee drinking was protective to these diseases. However, for hip fracture, yes, the point estimate was 1.13. Yes, a slightly increased the risk. However, the 95% confidence interval included 1, so these statistical estimates were insignificant statistically. However, yes, the coffee draws out calcium from the body. So I think we should understand these results, hip fracture, these results, based on medical knowledge. And yes, duodenal also can be increased because of coffee drinking. Yes, coffee drinking increases the secretion of gastric acid in the stomach. So we should understand these results uh, based on medical knowledge. So yes, this is also understandable. Spina bifida, I cannot understand these results. Yes, I have to find several medical background for this association. For rheumatoid arthritis, the risk estimate was 1.31, and vascular dementia, the risk estimate was 1.96. Yes, the second figure is about decaffeinated coffee. Decaffeinated coffee also showed protective effects for most diseases. However, for urinary tract cancer and bladder cancer, the relative risk was statistically high, increased. Yes, 1 point for urinary tract cancer. The point estimate was 1.18, 18% higher than non-drinking coffee group. And the drinking coffee group showed a 29% higher incidence of bladder cancer than non-drinking coffee group. Even though the 95% confidence interval included 1, relative risk of 1, however, I think these two diseases can be understood based on medical knowledge. Yes, because when we make decaffeinated coffee, when we extract caffeine from the coffee beans, we use usually some chemical agents. However, these chemical agents could have a deleterious effect on our body. Yes, I heard that Starbucks Corporation is using carbon dioxide when they extract caffeine from the coffee beans. However, I don't know. Yes, carbon dioxide is yes not hazardous to our body. So yes, I think the decaffeinated coffee of Starbucks would be safe for our body. Caffeine. This figure only looked at the effect of caffeine on our body, not coffee. In caffeine included in the coffee. So Parkinson disease, most diseases, coffee drinking is protective to most diseases. However, for pregnancy loss and endometriosis and the low birth weight, the risk was higher for coffee drinking group. 21% for pregnancy loss, 26% for endometriosis, 43% for low birth weight. Yes, we could understand these research based on our medical knowledge because yes, the caffeine drinking could increase the risk of a pregnancy loss and endometriosis. Endometriosis is a disease of endometrial tissue is spurs into other organs in the pelvic cavity, and we could understand that this result lowers weight. Yes, we heard many times that caffeine drinking could cause lower weight. Yes, even 95% confidence interval was statistically significant. Yes, this is a summary figure for these associations. Wait a minute. The x-axis is drinking cups per day, and the y-axis is relative risk. When the cups of coffee a day increases from 0 to 9, yes, the cancer risk decreased for breast cancer, colorectal cancer, colon cancer, and skin cancer. However, for bladder cancer, somewhat increased up until 2 cups per day. However, I think this was because of decaffeinated coffee. For decaffeinated coffee, as we saw in the former table, the bladder cancer risk and the urinary tract cancer risk was increased because of the chemicals added to make the decaffeinated coffee, to extract the caffeine from the coffee beans. Yes, the gastric cancer risk was slightly increased. We saw this result from this table, this figure. The gastric cancer risk was increased slightly because of secretion of gastric acid due to the coffee drinking. The cancer mortality was slightly increased. Yes, for stroke and heart failure and cardiovascular disease and cardiovascular disease mortality. Until 4 cups of coffee was beneficial for your body. Yes, until 7 cups of coffee. However, after 7 cups of coffee, yes, the risk of cardiovascular disease mortality, yes, 5 cups, and heart failure increased. For other diseases, for Parkinson's disease and type 2 diabetes mellitus and all-cause mortality, gallstone disease, and metabolic syndrome, the coffee showed a strong protective effect. Until 5 cups of coffee and even 9 cups of coffee, the coffee drinking was beneficial for these diseases. And this figure is for caffeine. The x-axis is caffeine intake per day, milligram. until 300 milligrams of caffeine in a day, the risk of depression decreased significantly. Yes, by a large amount. About 60% risk was decreased. However, after 300 milligrams, the risk was increased again until 700 milligrams of caffeine. Yes, the Parkinson's disease risk and type 2 diabetes mellitus decreased until 700 milligrams of caffeine. Yes, the breast cancer risk was equivocal, yes, slightly decreased. Yes, this is the end of the first article, and the second article: effects of habitual coffee consumption on cardiometabolic disease, cardiovascular health, and all-cause mortality. This article was published in the Journal of the American College of Cardiology, and this is a review article. So I will take a look. This figure indicates the x-axis is coffee consumption cups per day, and the y-axis is relative risk of type 2 diabetes mellitus. The risk was decreased until 6 cups per day, and this figure is adjusted hazard ratio for risk of death according to cups of coffee for all-cause mortality as increasing coffee consumption. Yes, the risk was decreased. For heart disease mortality, the risk was also decreased. For all-cause mortality, the risk was also decreased as increasing coffee consumption. And for heart disease mortality, the risk was decreased along the increase in coffee consumption. This figure indicates that cups of coffee consumption in a day, the x-axis is, and the y-axis is relative risk of heart failure. The heart failure risk was decreased until 4 cups of coffee. However, after 4 cups of coffee, the risk was slightly increased. Yes, the risk at the bottom was 90%. About 10% of risk was decreased due to consumption of coffee, and increased. And 9 cups of coffee, the risk was equivocal. And after 9 cups of coffee, 10 cups of coffee, the heart failure risk was increased. This figure indicates the risk of arrhythmia. Yes, various arrhythmia are presented in the x-axis, and the risk was decreased for any arrhythmia. However, for PSVT, paroxysmal ventricular tachycardia, the risk was increased. So yes, for other arrhythmia, for example premature beats, the risk was significantly decreased. However, the 95% confidence interval was so wide, so more studies needed for these diseases: premature beats, other arrhythmia, PSVT, and paroxysmal SVT. Yes, for paroxysmal SVT and paroxysmal ventricular tachycardia, the coffee was somewhat hazardous. Yes, so it was risky. So we should understand these results. For coffee intake and for diabetic subjects, the total mortality was decreased. This cardiovascular disease mortality was also decreased along the increasing coffee consumption. Coronary heart disease mortality was decreased, and stroke mortality was decreased, however increased after 7 cups of coffee. Yes, I think 5 to 6 cups of coffee might be appropriate to our body. Participants over age 65, the cardiovascular mortality was decreased along the increasing consumption of coffee. Heart disease mortality was also decreased for the participants over age 65. This figure, indicates the risk of depression. The risk of depression was also decreased along the increasing caffeine consumption. Caffeine is important for depression. for preventing the risk of depression. After about 550 milligrams of caffeine a day, the relative risk of a clinical depression was decreased to about 20%. As the 95% confidence interval was also statistically significant. As this is the end. So, today we reviewed these two articles, the first article and the second article. Based on these articles, we could understand that coffee is generally beneficial for our body. However, some diseases, the risk of some diseases could be increased. In particular, gastric cancer, childhood acute leukemia, childhood acute lymphoid leukemia, and childhood acute myeloid leukemia, and hip fracture, duodenal ulcer, rheumatoid arthritis, vascular dementia. Yes, the risk of these diseases could be increased due to coffee consumption. However, for most diseases, coffee consumption was protective to these diseases. Yes. For decaffeinated coffee, the risk of urinary tract cancer and bladder cancer was increased. However, for most other diseases, the decaffeinated coffee was protective. And for caffeine consumption, most diseases were beneficial by drinking coffee. Caffeine, however, the risk of pregnancy loss and endometriosis and low birth weight was increased due to increased consumption of caffeine. Yes, and yes, the risk of, wait a minute. Yes, paroxysmal supraventricular tachycardia and paroxysmal ventricular tachycardia could be increased due to coffee consumption. Yes, in particular, over 3 cups per day. So, the arrhythmia patients, and the gastric ulcer, patients with gastric ulcer and duodenal ulcer should not consume excessive coffee, about over 3 cups of coffee. However, for most general population, until about 5 cups of coffee consumption could be beneficial for their health. Yes, for your health. So, yes. Please understand the results of these articles based on medical knowledge. Yes. Coffee is beneficial for most health conditions for preventing most diseases. However, except for gastric cancer, childhood leukemia, and paroxysmal supraventricular tachycardia, and and yes, decaffeinated coffee could be hazardous to urinary tract cancer and kidney cancer, yes, bladder cancer. Yes, however, for most other diseases, the coffee consumption was beneficial for your health. Yes, thank you for listening my presentation.